Alright, so the next one I'm going to talk about is spina bifida. So spina bifida is a birth defect that occurs when the spine and spinal cord don't form properly. It falls under the broader category of neural tube defects. The neural tube is the embryonic structure that eventually develops into a baby's brain and spinal cord and the tissues that enclose them. Normally, the neural tube forms early in pregnancy and closes by the 28th day after conception. In babies with spina bifida, a portion of the neural tube fails to develop or properly close, causing defects in the spinal cord and the bones of the spine. So, spina bifida can range from mild to severe depending on the type of defect, size, location, and complications associated with the disease. When early treatment for spina bifida is necessary, it's done surgically, although such treatment doesn't always completely resolve the problem. So there are different types of spina bifida. There is spina bifida oculata, meningicola, and meningiticulo. Sorry, those are hard names. And oculata means hidden, so it's the mildest form of spina bifida. And meningicolita is a form of spina bifida called meningicolita that protective membranes around the spinal cord push out through the opening in the vertebrae, causing a form filled with fluid. So this can cause nerve damage in the spinal cord as well. So myelocenisil is the most severe form of spina bifida, and this is when the spinal canal is open along several vertebrae in the lower to middle back. So that also makes the baby who is born with that really prone to threatening infections that could happen. So symptoms, in oculata, the spinal nerves aren't usually involved. Typically, there are no signs and symptoms, but visible indications can sometimes be seen on the newborn's skin. A small dimple or a birthmark. A meningocele is the sac of fluid that is on the back. The most severe form of spina bifida, the spinal canal remains open along several vertebrae, and both the membranes in the spinal cord are nerves protrude at birth, forming a sac. Tissues and nerves usually are exposed, though sometimes it is covered by the fluid sac. So typically, spina bifida is diagnosed while the baby is still in the womb, so that kind of leads to having specialized treatment when the baby is born. And the causes for spina bifida, there's not really any known causes at this point. It appears to result from a combination of genetic and environmental risk factors, such as a family history of neural tube defects or folate deficiency. So the risk factors are that people with spina bifida can come from women who have diabetes, are obese. That kind of is something that they think could be a distributing factor to somebody having spina bifida. A woman who doesn't treat their diabetes and doesn't take care of themselves during pregnancy can lead to that. Same with somebody who is obese. If they are obese and becoming pregnant, they have more of a risk factor of getting spina bifida. The other risk factor is a folate deficiency, so a B9 deficiency when a woman is pregnant, and the family history part of it. The complication, there's walking and mobility problems, orthopedic complications, bowel and bladder problems, accumulation of fluid in the brain, shunt malfunction, and malformation type 2, infection in the tissues surrounding the brain, tethered spinal cord, sleep disordered breathing, skin problems, latex allergy, and there's a lot of other complications that can go on with having spina bifida as well. And then the treatment that is available is there aren't really many treatments available, but there's walking and mobility aids, bladder and bowel management, surgery, and just kind of management through medications. You're going to need ongoing care if you had spina bifida, especially if you had the really severe type. you're going to need lots of different types of care that are associated with it. And there definitely are a lot of clinical trials that are being tested out right now. People with spina bifida don't typically live that long if they are chair-bound. Just because of all the different things that go into it. It doesn't just affect their back, it affects all of their internal organs as well. But they do have the opportunity to live a full life. So